Okay, hello, my name is Marion Reneau. I'm the owner of the Skin Institute School of Aesthetics in St. George, Utah. The Skin Institute is a sophisticated training facility that trains individuals to find careers in the spa industry. We have a basic aesthetics program and we have a master aesthetics program. Today we will be demonstrating microcurrent technology. This basic training that we will be covering today with microcurrent technology can be utilized in all the HEALTHandMED.com machines that offer microcurrent. Okay, so microcurrent facial toning is a fascinating modality. You can perfect it, learn more, get your own techniques. Because it's such a gentle current, you're not going to hurt the tissue. So just experiment around with it and have fun, take more classes, and enjoy the modality. Clients ideally should have facial toning done as often as twice a week. That's the ideal. Often clients can't come in twice a week. Americans are so busy. If they can get in once a week, that's really good. Clients should commit to coming in to having 10 to 12 sessions with you. At that point, their facial toning and lift should last approximately 3 months. After the initial 10 or 12 treatments, some clients want to have a facial toning session done once a month. Some clients decide to come in just when they feel like they need a freshen up session and a toning session. Some clients enjoy having a toning session before special events. Maybe they have a daughter that's getting married. Maybe they're going to a class reunion, or maybe they're having family photographs, and this is a wonderful way to give them a freshen up lift. Short of having a full face rhytidectomy or full face facelift, I know of no other procedure or modality that is as effective as microcurrent facial toning. And the microcurrent facial toning certainly is less costly than a facelift, certainly less painful, and far more enjoyable. This is the Health and Med Skincare Specialist NVQ606 machine, and it features a wonderful microcurrent modality. Microcurrent technology is the only aesthetic treatment available that can physically firm and tone the skin through muscle re-education. This is a process of gently re-educating the fine facial muscles, and it stimulates them with very small amounts of electricity. Microcurrent is a specific amount of electricity that mirrors the body's own natural current and works in harmony with the body's electrical system. Microcurrent technology has been around for decades. It's a safe current. It's a much more gentle current than is even used in electrolysis. Microcurrent impulses trigger a chemical reaction at a cellular level to increase the effectiveness of how our bodies use ATP, a protein that is referred to as the energy of life. Microcurrent technology is wonderful for that middle-aged client, especially the baby boomer era. It's great technology for anyone that wants an anti-aging treatment and firming and toning of muscles. It's a wonderful treatment to be used on those crow's feet around the eyes and the lip lines, as well as lifting the jowls and cheek and forehead area. Besides lifting and toning, it also refines the texture of the skin and increases blood flow and encourages new collagen and elastin production. There are certain individuals where microcurrent facial toning is not suited for. These would include someone who's pregnant, perhaps diabetic, someone that's suffered with cancer, and anyone that has a pacemaker. If you have a client where their health might be in question and you wonder if this modality is a good fit for them, they can always bring in a letter from their physician. So our client today is Kelly, and she's a 50-year-old woman who is just experiencing the first signs of aging. She has some rhytids around her mouth area, some crow's feet or rhytids around her eye area, and some wrinkling starting on her forehead. You can hand your client a mirror and ask her to discuss her concerns and what bothers her the most about her skin tone and face. We've cleansed Kelly's skin, and I've asked her to remove her earrings and any jewelry that she might have, necklaces and any jewelry in the facial area. In using the microcurrent machine, you'll have to place Q-tips in the ends of the probes. Your machine will come with a set of Q-tips with the wooden base. When you run out of these, you can buy any Q-tips at the drugstore, and be sure and get ones that either have a wooden base, a wooden stem, or the rolled paper stem. Do not purchase Q-tips with the plastic stem, as they will not conduct the electrical current for you at all. When inserting the Q-tip into the end of the probe, you'll need to break the Q-tip off quite close to the head and merely insert it into the end of the probe. It's important to use only distilled water with any type of microcurrent toning. If you're new to facial toning and lifting with the microcurrent technology, you might want to have a cheat sheet that shows you each facial toning step. Begin practicing on friends and family, and they won't mind if you put your little cheat sheet right on the décolleté area. It also helps to have the faces on your little note sheet facing the exact same way that you're looking at the client, so the sheet is actually upside down. So now we're ready to turn the machine on. There's a master switch in the back. For facial lifting and toning, you must turn the bio mode on. It's in the off setting right now. And when it's on, this square begins blinking. Then for facial lifting and toning, we want it on the B mode. So we'll use this button, the bio mode button, to change it to the B mode. The first step that we're going to do is work on the mentalis muscle. This is an alternating current, so you can place one probe and then move the other, and they move apart. Yes. You should hold them for the count of 6. So this is what I do. In my mind, I say 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000. Then move to the next area. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000. It's really difficult to overdo, but it's imperative not to underdo. It should be a firm pressure, but a fairly light touch. You don't want to be drilling into your client's skin with too much pressure on the probes. So each of these steps should be repeated twice. The important thing to remember is, because this is an alternating current, you don't need to get hung up with which hand is holding which probe. It doesn't matter, because the current is going to alternate effectively between the two probes. So this is a stationary probe, and this is step 2. Sliding Golgi. Remember to count to
6 long seconds. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. And repeat each step twice. I'm moving the stationary probes, these up a little. It's important to keep your Q-tips moist because it is the distilled water that's conducting the current. And then your stationary probe is going to go right under the nose. And then this is going to slide towards the nose. It's also important to keep your probes upright, almost like pencils. You don't want them flayed out like that. It's not unusual for your client to feel a metallic taste in their mouth, even if they don't have any fillings, or even if their fillings are not metal. It's not unusual to feel a metallic taste. As long as you tell your client that, then they won't be alarmed. And then this is step 3. It's important to keep taking classes and perfecting your technique and knowledge about microcurrent and facial toning. And you can usually find classes at various aesthetics and spa conventions across the country and in your neighborhood. Now step 5. Place the stationary probes here. I'm going to lift this whole cheek area. Okay, and I'm going to repeat that. Also, another thing is don't be afraid to take your client's head and move the head like this. Sometimes I forget and you can see that I'm twisting my body, and that's hard on my body. It's not ergonomically correct. So feel free to move your client's head. Remember to use firm but gentle pressure. Your client should never feel like you're drilling into her skin. You can see that my Q-tips are getting a little bent, so feel free to replace them. Okay, I've moistened my new Q-tips. Now just gently working the eye area. And I'll come back and do some more fine-tuning around the eye area. Right now I'm still staying out of the orbital socket. This is step 7. And step 8 is actually really interesting. It's through the hairline. So think of just doing a little facelift through the hairline. You might need to rehydrate because the hair does soak up quite a bit of the water. Now you want to do a second row even deeper into the hairline. This should be a really relaxing treatment for the client. In fact, it's usually difficult for the client to even stay awake through the whole treatment. Always a compliment when your client falls asleep on the table. Okay, at this point, this is a good time to change the Q-tips on the end of your probes. As you've been in the hairline, you're going to go back to the face, so for sanitation reasons, be sure and change your Q-tips at this point. Okay, so now I'm going to work on the frontalis muscle. This is a very strong muscle in the face, and the first thing we're going to do is lengthen the muscle and try to smooth out those frown lines. And repeating the second time. So you notice what I do is I work on one half of the face first, and then I move to the other half of the face. So I work on the right side first, and then I move to the left side. You don't have to do it like that. You can do it in sections, whatever's most efficient for you. After I have lengthened the muscle, moving the two probes apart, I go back and lift the whole frontalis muscle like this. I've asked experts in classes that I've taken, does this confuse the muscle? Because at first you're lengthening and separating it like this, pulling it apart, and then I'm getting energy in the tissue and lifting it. And the experts, people that are a lot smarter than I am and have more experience in facial toning than I do, have said, no, that's fine to do. You'll create your own little nuances and techniques. It's a fascinating technology. The more classes that you take, the more little techniques you learn, all the better. What we're showing you today are just the basics. Going to do some fine work around her eye area, and I'm going to change the mode from mode B to mode C. Easy enough. So I'm also going to change probes and utilize these probes with the balls on the end. With these probes, you'll need to use a conducting gel instead of distilled water. So any product can be used that's water soluble and is formulated for the eye area. So I'm just applying the conducting gel generously with a little detail mask brush. So this is the time when you can go inside the orbital bone. These probes work very nicely for this. Remember, smooth, even strokes. Let the machine do the work. This feels really wonderful for the client. I'll repeat. This special setting allows you to work inside the orbital bone. You can even go on top of the eyelid. Make sure they've taken out their contact lenses. It would not be unusual for them to see a flash of white light. Sometimes they do, sometimes they don't. As long as you tell them about it, they're fine with it, because they know that you know what's going on. This just helps with the crepiness around the eye area. You can go right through the brow. Another trick I've learned is lifting the brow. You're kind of pinching and lifting through the entire brow area. And repeat. Another trick that I've learned is to just really hold the probes together like this and really work those little iridids or crow's feet right around the eyes, working them together. Smooth strokes. You can also use this probe to get energy into the tissue over the top of various wrinkles. So you would straddle the valley of the wrinkle like this. Just get energy into the tissue. Because this is an alternating current, the microcurrent is actually jumping back and forth between the two probes. Again, this is microcurrent. It's not anything like really strong currents that the chiropractor might use, or currents that athletes use to reduce their abs and shape their abs and get that six-pack. That's not this current at all. This is microcurrent. So now I'm going to do some work on her neck. Some experts believe that you should not start any neck toning until after at least the first 3 facial toning. But other experts incorporate it right into all of their toning. The neck is actually far more delicate tissue than the face. You do not want to go over the hyoid bone. If anyone has a thyroid condition, they must have a note from their physician to proceed ahead with facial toning. This is the perfect time to use your ultrasound machine to push in product. Or you can use this aperture with the round ball tips to push in product also. First, you want to remove the conductor gel. So this is just a light moisturizer that I'm applying. You can use the round tip probes to push product in. Or your ultrasonic spatula. This feels so good. Okay, and then obviously you're going to repeat all these steps on the other side of the face. And when you've completed pushing the product in, this is the perfect time to apply sunscreen. Okay, we've finished our facial toning session for today. Obviously, you're going to want to clean your probes. You can use alcohol wipes or a gauze or cotton pad saturated with alcohol to gently clean the probes.